Male plastic surgery is on the rise, up 325% in the last 20 years. Wow. Here to explain more, our good buddy, Dr. Chaffoo. Good morning, sir.
Good morning. How are you, Raoul?
I'm doing well. Okay, let's talk about this change that has happened in making men consider plastic surgery. Is it just more open-mindedness and more acceptance of people? Because before, 20, 30 years ago, there was a little bit of shame, like the men doing this, not the women.
So exactly, Raoul. So we're seeing actually a dramatic increase in the incidence of male plastic surgery. We've actually seen in the past 20 years about a 330% increase and actually about a 40% increase in the past 5 years. So I think a lot of this is due to the fact that, you know, there's more people that are more likely to come out and talk about it, where celebrities will talk about it, the new technology that's available, more natural results. There's a lot of information on the web. You know, one of the things that's become a big part for males is what's called hair restoration surgery, and this has changed dramatically. The old technique of taking a strip from behind the scalp and making a scar on the back of the head has been replaced by what's called FUE, or follicular unit extraction, using a new device called the NeoGraft, where the individual follicles are extracted from the back of the head. There's no linear scar in the back. It's a much shorter recovery, and the results are really quite natural. You can see they're very small grafts that are harvested, and they're placed in very small sites within the recipient site in the front of the scalp, so it looks completely natural. And it's a very short recovery. The recovery is less than a week. So we're seeing many times practices up to about 50%, at least in our practice, of our patient base now is related to men, and a lot of this is hair restoration surgery.
Yeah, as a man, who's a good candidate for hair restoration? Because sometimes in the past you would hear about if you're completely bald, there's no going back. But if you're starting to thin, that's the good time to do this. Does that rule still apply?
Well, in one way, Raoul, it's true. I mean, if you're beginning to thin, then that's the time you can consider hair restoration surgery, to where the results will be quite subtle. But we do see men who have lost a considerable portion of their frontal hairline, or almost the entire frontal hairline. And we're actually able to recreate the hairline and recreate it in a very natural, mature way. So literally, they can go out, you know, come out of the shower or out of the pool, slick their hair back, and really no one's going to know they've ever had hair restoration surgery done. The great thing about this, Raoul, is a permanent treatment. So once these grafts have been harvested from the back part of the head and they've been transplanted to the frontal area, they grow there and grow permanently throughout the rest of your lifetime. There aren't many things that we can say are permanent. Okay,
talk to me about this CoolSculpting, because I've heard about, and you know, for a lot of the guys that can't rid of the love handles, you know, the love handle is still a thing?
Yeah, so actually CoolSculpting is a type of treatment that's been FDA approved. It's utilizing a device where it's a placement of a suction device or a flat panel on areas where there's extra fat. Literally, the fat cells are frozen and they naturally dissolve after 2 to 3 months.
Wow.
And with one treatment, we can see about a 20 to 25% reduction in fat. And in fact, with multiple treatments, we can see results that are not that dissimilar to liposuction. The nice thing about this, Raoul, is there are no needles, there's no injection, there's no recovery. And so for people that are busy, men of course, women as well, they don't have a lot of downtime, they don't want to undergo an anesthetic, it's something that can be done, and it's really changed the way we're doing sculpturing of the body today. And also the face, the neck area, you know, a little double chin that people get very effectively treated by CoolSculpting.
Can we talk about price range for the hair restoration and also for the CoolSculpting? Because I know it kind of, there's a wide range. You could only maybe need a little bit of work and maybe need a lot.
Sure, so there's quite a range. For example, if we're talking about doing CoolSculpting, it depends on the area treated. So an individual area may cost between $800 to $1,200. There may be, you know, several areas that need to get treated. For hair restoration surgery, like you said, it depends on the area that's treated. It could be anywhere from $5,000 to $6,000 to $12,000. The most important, I think, take-home message for people that are thinking of plastic surgery: make sure you seek out a surgeon that's certified by the American Board of Plastic Surgery, a member of the American Society of Plastic Surgery, because we know that the ultimate results of cosmetic surgery are related by who you choose to do your procedure and not necessarily the technology.
Very important information. Dr. Chaffoo, as always, we thank you.
Good to see you.